About 75 to 80% of women at some point in time will develop hot flashes that can begin prior to menopause, commonly in what we call the perimenopause time, the few years leading up to menopause. Usually the symptoms that they'll have is this internal feeling of warmth, sometimes some flushing, tends to be more central, kind of rises up. For some women, it actually causes quite a bit of anxiety. It can occur at night. It can occur throughout the day. For some people, it's every once in a while. For some people, it's often. So the main symptoms that people will come in with is that, and sometimes it's socially awkward. They'll have some sweating with it. And so a lot of times people just want to know what it is and what the treatment options might be, what's causing it, how long they can expect it to go on for. And so what's interesting is in the last couple years, a lot of research has come out saying, the menopause related hot flashes actually tend to last a lot longer for a good portion of women than what we originally thought. As far as talking about 1 or 2 years, that's probably a little bit more on the low end. For a lot of women, it can occur for decades. And so the reason for hot flashes is we know that with menopause, you have lower levels of estrogen being made by the ovaries, and this can be surgical menopause too, meaning people have had their ovaries removed. And so that lower level of estrogen actually triggers an area in the brain, some nerve receptors in the brain, in the front of our brain called the prefrontal cortex, and that's the area that controls our temperature regulatory system in our body. And so the low levels of estrogen kind of alters that, and basically what it does is it changes what our body's ability to accommodate different temperature changes. And so we're only able to kind of accommodate a smaller, more narrow window of temperature. And so any sort of fluctuation in that can really trigger a hot flash. And so there's fortunately a lot of good treatments for that. The gold standard treatment is hormone replacement therapy, and that is the one that has the most data. And for a lot of women, that is a great option. Guidelines are to use the lowest dose for the least amount of time. However, there's also a lot of other treatments for that, including some of the antidepressants, actually typically at a lower dose than what's used for depression, but is FDA approved for treatment of hot flashes. And of course, there's a lot of lifestyle things too. We talk about sleeping with fans on, cooler temperatures, wearing more cotton clothing, decreasing caffeine intake, and things like that. There's not a lot of approved data for herb supplements and that kind of thing for hot flashes, not at this point anyway, but for a lot of women there's really some other good options as well. At our clinic, you're able to either self-refer, just call and make an appointment, or sometimes people will have their primary care clinician put a consult in to see us. So we're happy to see either way, whatever works best for the patient. So self-refer or consult.